Welcome to Silicon Slopes Live. We have Dr. Barrett from the University of Utah on with us. Dr. Barrett, how are you?
Excellent. How are you?
Doing very well. One, to start, I just want to thank you and the University of Utah for everything you're doing during this pandemic. Your leadership here has been amazing. Thank you so much.
Thank you. It's been an interesting ride so far.
We're going to talk about how technology is transforming the way we deliver healthcare and the way the COVID-19 pandemic has really jump-started progress toward delivering care in the way that we knew it was heading anyways, but it's really, fast forwarded and jump-started the whole thing. And so first question for you is, how is this crisis moved this technology in healthcare forward in Utah and nationally?
Okay. Well, I think the biggest thing that comes to mind is the use of video visits to replace in-person, face-to-face visits. A lot of different moving parts to that, but in general, many of us, as you pointed out, knew that video visits and virtual interactions were coming to replace a lot of face-to-face medical care. But what this did was really accelerate that process. And there were a lot of things that accelerated it. One of the main things was governmental and insurance company regulations to pay for those video visits. So now, whether that'll last, and we can talk about that too, but right now there's an equivalency of payment so that your medical providers are a lot more interested in providing that kind of care. And then the other thing that happened locally that we saw, our doctors, and again, I should say, a lot of this was the world according to Dr. John Barrett, not the world according to the University of Utah. It's just what I've seen in my kind of operational position. We had a lot of clinicians, a lot of docs that were hesitant to use video platform with their patients. And it really motivated everybody to get this done when they saw that their patient visits, their patients couldn't come see them. Messaging was put out there that, hey, we want to keep you safe, so we're only seeing emergency type visits. People have turned really quickly to using video platforms. And that's been true. You asked about nationally as well. That's been true nationally too. One of the really interesting things is that some of these video platform companies, and I know y'all are familiar with them. Many of the people out there probably wrote them and invented them. A lot of these video platforms didn't really focus on healthcare, but some did. And some have been through the vetting process regarding privacy and security that healthcare requires. But boy, the federal government said, okay, for now, during this crisis, we're going to waive some of those rules and regulations that have been in place. A lot of the red tape got cut away so that people could access this kind of care. And that's been true, again, locally, as you pointed out, and nationally as well. I'm in communication with colleagues around the country in more hotspots like San Francisco, like Seattle, and the same has been true. People have, clinicians, docs have turned to these video platforms very quickly. So that's really the main thing, is the video visits, the uptake.
What surprises or what changes have surprised you, and what changes would you have predicted?
Okay. I think I've been most surprised by the patient's acceptance of this. Like, people really have been on board with doing video visits with their providers. One of the assumptions that people make sometimes is that elderly people are not going to want to do video visits. Actually, and it's sort of a duh moment. Actually, people just want to hear from their doctor. They want to have a sense of that communication with their doctor. And that surprised me a little bit, is across the board, the very quick adoption of this as a standard. What I would have predicted is the provider side, the doctor side. Um, that once this was made easy, once there was an easy button, right, an easy button on the doctor side, um, that seemed pretty clear to me. That once the barriers were taken away, that the doctors would be very willing to deliver healthcare over a video interaction. Um, that's predictable.
What do you think the long-term impact will be on the healthcare system? What do you think will stick and what do you think might not?
It's a great question. Um, well, video is clearly going to stick. There are a ton of of different types of interactions that don't really require an in-person visit. Obviously, if you've got something worrisome, that's a lump or a bump that needs to be touched, if somebody needs to listen to your lungs, that's going to be harder to do. But many things are visual, and many things are what we call taking a history, which is simply just talking to the person about that condition. That's going to stick. We're going to see a lot of medical care delivered, um, particularly the kind that my group does, which is primary care. Just good old, it hurts here. Is this pink eye? Do I have a sinus infection? That kind of thing. Um, what might not stick right away is unfortunately, the willingness of uh, payers, insurance companies, the federal government, the people who pay the bills for healthcare. They might not be as willing to pay for this kind of care in the near future. Um, in the long run, I think they will, but that may not stick right away. Um, what else? The the coordination of care, and by coordination of care, I mean having someone that you talk to about your general health who can point you in the right direction to advise you if you need an in-person visit, frankly, to say, oh, you need to come in and get this test. You need to come in and get this thing done, as opposed to you can just be at home and I can send your prescription to the pharmacy. I think that's a big part coming out of this, coordinating care.
Uh, are you concerned about the workforce in healthcare? I know, although I believe the governor has said now that elective surgeries are back on at least at some point this week, but I know that that's been a huge challenge with the workforce with the inside of healthcare. And, so there's been some layoffs at some institutions and some haven't. How concerned are you on that front?
I'm very concerned about that. And one of the things that I think we're going to see in the medium to long term, so in the year, 2 years, 3 years, I think we'll see fewer people interested in going into healthcare, because it's going to change so dramatically. That'll come back. It'll come back because the need will be there for humans. Um, you had asked before about what surprised me, what doesn't surprise me. I think we're a long way from an AI or a chatbot being able to have an interaction with a person, whether that's on a video screen, a phone call. Um, we're going to need people in healthcare, but given what's going to happen to healthcare over the next 3 or 4 years, we're going to have to get away from this fee-for-service environment. That's where you get, the insurance company gets a bill every time you go to the doctor. That's fee-for-service care. Every time something happens to you, there's a bill that gets paid. We're going to see more of, and better, I should say, from my perspective, arrangements where people are paying a lump sum as they go, and that care is provided not based on how much you do to someone, but what you do for them, how well you help them. So yeah, I'm worried about the workforce in the short term. Is if we do have people leaving healthcare, not going into healthcare, what happens in that 3, 4, 5 year time frame when we don't have enough clinicians, enough trained professionals to take care of people?
So we're probably a ways out from like robots taking healthcare jobs. Although at some point in the long horizon, that could become a possibility, right? But
Yeah.
currently, that seems fine. What are you most optimistic about, and what are you most pessimistic about?
Hmm. I sent that question in. I shouldn't have sent that question in. That's so hard. I'm kidding. No, but it it changes every day with the COVID numbers, right? I mean, honestly, what I'm most optimistic about is the long run because I don't know jack about tech and innovation compared to all of y'all out there listening and hopefully watching or whatever. But this disruption that has occurred, look, it's a lot like the other disruptions that have occurred with medicine. Wars have really furthered medicine, right? World War II was the advent of antibiotic use. Um, the uh, the Vietnam War was about field trauma care and triaging folks and getting appropriate trauma care and helping people survive. And even the Middle Eastern conflicts recently, a lot of that has been about prosthetics, better care for head injury and PTSD. So we see these advances when there are these crises in medicine, and I'm optimistic that this disruption is going to help with the cost of care, which is too damn expensive. Um, the coordination of care, which I've already mentioned, where the depersonalization. It's kind of weird to be talking to somebody over a video screen and mention this, but there's been a lot of depersonalization in medicine, and I actually think this will help personalize it more because you'll be able to connect with your clinician, like me, your friendly primary care doctor, um, a lot easier than you used to. You don't have to drive to a parking lot, sit in a waiting room, all that kind of stuff. So the cost will be improved, coordination of care will be improved, and we'll learn a lot more because technology is going to help us monitor people. Think about Fitbits on steroids. Again, the stuff that a lot of y'all out there are working on right now, and more power to you. Pessimism. I am I am I am concerned that we're going to see a resurgence of this disease come, let's say, the fall, next winter, that we'll see a resurgence of COVID. Um, and we'll have to go through a lot of this again. And that's a little bit of a drag. It's really more a drag it's a big drag for healthcare, right? Because people are not seeking routine care, which they need for healthcare maintenance, et cetera. Their mental health suffers, which is bad for your health in the long run. All y'all know that. Um, so I guess I'm pessimistic about the short term until we have a vaccine, um, until we have significantly greater herd immunity. I think we're in for a tough year or two. There's just no doubt. There was a great article called "The Hammer and the Dance." If y'all want to read a really good article about, I mean, I can't predict the future, but somebody who was very thoughtful about what they think the next couple of years is likely to be. The hammer is the lockdown, right? We're in sort of a hammer phase, but we're about to enter into a dance where we dance out of our basements and we go back cautiously and interact, and then there'll be a resurgence and we'll be back in the hammer phase, and that's probably going to go on for a while.
Dr. Barrett, if it does come back in the fall in a major way, what do you think the odds are that we do all this again? The stay safe, stay home directives, these stay at home orders. Do you think people will do that again?
Great question. Yeah, in Utah, I think people will do it. I think Utah has a great sense of civic pride, of taking care of one another. I know there's absolutely, and I understand it. There's an element of don't tell us what to do, and you saw the protests the other day. But I think at the end of the day, um, look, I've been impressed with the state government so far, local government here in Salt Lake, Salt Lake County. Yeah, I think reluctantly people will do it. we'll need a good safety net for the economy, and that will hopefully be in a better place because we'll have more time to puzzle through exactly how to do that.
Dr. Barrett, I just want to thank you and the University of Utah Health for everything you're doing during this. It really has been life-saving and life-changing and helped Utah in such a dramatic way. Thank you for everything you're doing. I'm sure we'll have you back on, Dr. Barrett, but I appreciate you taking the time to speak with us today.
It's great, Clint. Thank you at any time.
Thanks, Dr. Barrett. Have a good one.
Take care. You too.
Okay, we're clear.
Sweet.
That picture he put on the wall is brand new. So you have